We're in a very exciting world today where medical providers and dental providers are increasingly collaborating on their patients' care. And leading the way and allowing folks to do this is telehealth. So it's really kicking up, and technology is really helping the medical and dental integration. Today, I'm really happy to have on my show Maria Kunstadter, who is the founder and the chief dental officer for the Teledentists, and also Dr. Jonathan Wiesen, who is the founder and chief medical officer for MediOrbis. So, Jonathan, Maria, thanks a lot today for being on the show.
Thanks for bringing us together. This is great.
Pleasure. Thanks so much, Mike.
So, Jonathan and Maria, I know you recently announced a partnership to work together to help medical providers and dental providers collaborate over the cloud. So can you just talk a little bit about the partnership, and then we'll delve into kind of why we're doing this?
Absolutely. Jonathan and I have been talking about partnering for several years, and when COVID hit, we all managed to do our telehealth specialties, got through COVID, and we're still in COVID, but we managed to bring our heads up and say this is a great collaboration. Since 2000, medical has been calling for the integration of oral health and medical health. And with telehealth, as dentistry is a specialty, a subspecialty of telehealth, it was a logical choice to bring them together on the same platform. And Jonathan and I have agreed to work together on this exciting project for 2021 moving forward.
And so Jonathan, how did Maria's a dentist? You're a physician. How did you folks meet? How did you get together to really discuss this partnership?
Sure. So the emphasis in medicine today is really on collaboration, working together with different specialties, different individuals with different skills. And it was in that spirit that this partnership just seemed to make a lot of sense. In clinical medicine, I work in the intensive care unit in critical care. And we're always consulting specialists, we're always getting opinions. And in internal medicine, general medicine, we do the same. So it just made a lot of sense to bring as many different subsets of healthcare together to be able to provide a more comprehensive solution.
And the general public knows the correlation between oral health and total health. I mean, they hear it from all their different subsets of magazines and articles, and they hear about it. And what I've heard from medical specialists, yeah, we know oral health is important, but we don't know what to do about it, so we don't mention it. So that was the driving force to bringing an enlightened medical group together with us to say, now at the tip of your fingers, you can have access to either your physician or your dentist easily. And that it's a great opportunity. It's a new tool to be able to move that project forward.
I like that we're considered enlightened.
But you are.
Right, we're the educated.
Yeah. I guess the best thing about this whole partnership is everybody gets enlightened, right? The physicians and the dentists get enlightened. So,
Exactly.
so it was interesting. I saw a presentation that you gave where a very interesting slide that really struck me. And it talked about how a lot of people go to dentists, but they might not go to their medical provider. And then conversely, a lot of folks go to physicians, their family care practitioners, and they might not go to dentists. So can you both talk to me about kind of this chasm and kind of what's going on here and the problems we have with this?
Absolutely. I was going to say that. Go ahead, Jonathan.
Yeah, so there are really two different aspects that are worthy of consideration. The first is access, and the second is care. I have a close friend who's a dentist, and he measures patients' blood pressure before he evaluates them. And now they're being recommended to check their blood sugar as well, because that brings access to healthcare. So when you are engaged in primary care, regardless of whether you're a physician or a dentist or a podiatrist or an MA or a visiting nurse, it doesn't matter, because you're bringing awareness and access to healthcare, bringing things to patients' attention. And then there's also the comprehensive nature of care, where impacting the care in one area directly manifests in the other. The better controlled your chronic medical conditions are, the better your oral hygiene will be, and vice versa.
Absolutely. And Jonathan, thank you for mentioning the blood sugar and hypertension, because the chart you were talking about, Mike, is that 108 million people before COVID saw a physician that did not see a dentist in a year, and 28 million people saw a dentist but didn't have a physician. And as a practicing dentist, they were recommending we do blood sugars, but I kept thinking, why would I do that when I can't do anything about it except say, go see a doctor? Now we have introduced this platform to have in dental offices and medical offices, where if the practicing dentists, if the patient has a high blood sugar, they can push a button and talk to one of Jonathan's groups and start being treated and maintained for diabetes or whatever they need to. And that happens right there. And it doesn't go, oh, I'll see about it and go off. And compliance is terrible. And, if you send somebody to go see a doctor, sometimes they never come back even to the dentist. So if you right there say, let's get you connected to a doctor that can maintain and monitor this condition and get you healthy, that's such a service to be able to offer to patients, and the convenience is everything now.
So Jonathan, I'd like to ask you a question. The physicians, your telehealth physicians, is it a challenge at all, or was it a challenge? Because obviously they have to make that call, right? When the patient's with them, like, hey, do we talk to a virtual dentist? Is there need? So talk to me a little bit about the education process that your virtual physicians went through or go through to be able to really understand and make that call when there is a virtual dentist needed on the other end.
Well, Mike, remember, you're preaching to the choir. So these are people that already believe in the value of telehealth and do it extensively. So this is just an extension of what they already believe and see to be useful. When I started in telemedicine 6 years ago, every conference was all about convincing the world that this was a great value proposition. Now it's not about convincing them that it's useful, but finding the best use case.
Okay, and Maria, I guess the same question for you. Did your dentist, your virtual dentist, have they drunk the Kool-Aid basically and really believe also in this collaboration that you're doing, or was there a little bit of education that you also have to do on your end with your
There
virtual?
will be, as I said, we just offered this to Anthem providers, and that's 99,000 dental offices. I mean, this is so new and so exciting that we're offering this up, and the education component of now in your office, you can have this as an offering. So this is our really 2021 platform, Mike. So Jonathan and I are diligently working to move this mountain to the people that haven't yet caught on, but it is so critical with value added care. I mean, that is a key word in medical now, value added care. And that means add oral health. That means, that you integrate to again, what I always talk about with physicians is you can't get A1Cs under control if there's poor oral health. There right now is a study out of the UK that correlated poor oral health and worsening conditions with COVID, and an 8% increase in death from COVID with patients with periodontal disease. So it goes from the whole gamut of monitoring chronic disease patients to critical care. And then with Jonathan is a pulmonologist, and going all the way into the trach and all of those things are so critical to oral health being a component of that people didn't do it because they didn't know where to go. Now they have a tool. And one of my advisors used to be the insurance commissioner for the state of Missouri. And he said, pretty soon it won't be, did the patient have a dental consult? It will be, why didn't the patient have a dental consult? Because it's available and easy to access. So, integrating all healthcare with the patient is value added, better patient outcomes, reduced, medical costs. It's win-win-win. And we just have to continue moving that needle. Big job, but we can do it, right, Jonathan?
So Jonathan, I have a question. As you know, having been in medical technology myself for a number of years, I'm really interested. Are you an outlier out there, kind of talking about the need to collaborate with dental counterparts, or is this a movement happening? What's going on in medicine in terms of oral healthcare awareness and working with the dental community?
Yeah, I think it's hard to look around in today's environment and not see that digital health, telehealth, and remote access are words that are being thrown around in a way that they never have in the past. And I've seen everything from telemedicine for neonatology to telemedicine for seizure management and the management of refractory epilepsy to transplant medicine being managed via remote health and telemedicine. The list goes on, and it's literally endless. It's an amazing program and opportunity to be able to provide remote dental care. And honestly, I would be shocked if there's anyone that's around in healthcare today that if you told them, hey, I'd like to bring a dentist remotely, would look at you with a funny look, because it's almost an assumption at this point that almost any type of clinical care can be provided remotely.
And Maria, so conversely, from the dental side, from what we're hearing, obviously there is a lot of information, evidence on how oral health helps, from the medical side. From the dental side, the need for a medical provider to collaborate. Talk to me a little bit about where you think dentistry and dentists in general are today in that awareness of the need to collaborate with medical counterparts.
Absolutely. And I can just tell you, since, again, the year 2000, the Surgeon General called for an integration of oral health and primary care. The Academy of Family Practitioners, the Academy of Pediatrics, and the American Dental Associations, and the CDC. So all of these organizations are saying this for now 21 years, this needs to be done to improve patient health. So there are two, in fact, organizations, Jonathan, that are dental organizations that are separate from the ADA, that are holistic or type of organizations that have physicians and dentists as part of the member organization. So it is happening. It is not yet what I would call mainstream. I mean, every time a blood pressure is taken, which is actually required by many state dental boards, that a blood pressure is taken, there needs to be the next step if there's unrelenting hypertension in that patient, even during that visit, because you aren't supposed to treat the patient with a high blood pressure for any injections or anything along that line. So rather than say, okay, I'm going to have to send you out, now we can have a tool, which we hadn't had before. So I think the adoption will happen much more rapidly by making it easy and simple and straightforward. In the past, it was send them out and hope they come back, and then you don't see them again. Now that you can have it in the office, when they go on their way home, they can pick up any hypertension medication that the doctor may say they need to start, and the patient has been, value added dental and medical care right there on the spot.
So, because this is, after all, the Dental Software Advisor podcast,
Mhm.
when I consult with my clients, I'm always talking workflow, right? When we look at technical solutions. And so I'm really interested. Let's start, Jonathan, from your side. Can you get into a little detail of the actual workflow between your virtual physicians and the virtual dentist on Maria's side, kind of how it works? If I'm a patient seeing one of your physicians, how does this actually work from a workflow standpoint?
Yeah. Well, again, we're in a very good time for software integration and for clinical services integration. So software platforms integrate together with relative ease through APIs. Providers are more than happy to collaborate with each other. So your emphasis on workflow is well positioned and well stated, and hopefully you agree with me that emphasis has, or I should say, the task of demanding exhaustive, comprehensive, and specific workflows has been made a lot easier by today's technology as opposed to that which we had, even just a few years ago.
Yes, I would. Well, I would agree. I mean, I started years and years ago, right, when I actually programmed, right, and was in software development. I mean, when you look at the technology available today, it's just amazing. So you're right on, and we're getting the ability to do like more automated workflows, right, and define
Right.
all that. So you're absolutely right about that. So Maria, from your end, again, when a patient comes in to see a dentist and they need to really flow over to talk to a physician, a medical provider, how does the workflow look from the dentist end of things?
Mhm. So when the dentist has the teledentist as part of their offerings in terms of in their office, it's called My Teledentist, and it's a program where they offer teledentistry in their office to their members, et cetera. When they have that program in their office and there is a need for a physician, they will just hand the patient a tablet or go to the computer right behind them, click on the teledentist, and then they have the option of choosing, do you need to talk to a dentist or a physician? And in this case, they click on MediOrbis and say, hey, I'm in Dr. Jones's office and they can't get my blood pressure down. I've had this problem all along. And they actually can have a telehealth consult right in the cubicle in the, within what, 6 to 10 minutes. They can actually speak to the physician, get on the road to some sort of mediation of their condition, and then they'll turn to the dentist and say, thanks, because I wouldn't have gone to a doctor in the first place. So we are connected when they go to MediOrbis. They can click on the teledentist if they have a dental concern. Same with us. If they're in the My Teledentist, they have MediOrbis as an option for care right there in front of them.
Yeah.
So post visit. Oh, sorry. Go ahead, Jonathan.
It is so important to meet patients where they are and not to demand things of them to meet your expectations. And being able to provide simple, streamlined solutions, being able to make things more accessible and more available allows patients to get the care that they need in the manner in which they need it, rather than trying to make them conform to a very strict, rigorous, and confined infrastructure, which is what we were unfortunately relegated to for many, many years.
Mm-hmm.
That makes a lot of sense. So really what you folks are saying is this technology is really helping to support flexibility, right, in patient care in spades. I was really interested. So post-visit, can the dental providers and medical providers, do they have the ability to collaborate on a case with a patient? Because we're talking about the real-time workflows, right? But afterwards, to kind of talk about it, make decisions. Is there a technical ability to do that?
Yeah, we on our platform actually, Michael, we have a referrer segment we can call the referring doctor in and have a three-way communication if need be with the patient, the doctor, and the dentist. So that I love technology too, Jonathan. Even though my brain doesn't work like that. But when people tell me I can push a button, I'm so happy to be able to have a three-way conversation with all the two professionals and the dentist, and that function is available. Yes.
And so one of the things, when I talk to either clients of mine who are interested in looking into telehealth or just questions I get from articles I've written, everybody's really interested in the future of medical dental integration. You guys are at the tip of the spear here, right? You've formed a partnership to start exploring, but obviously as you work together, we're going to see a lot more happening. Can you look at the future of the next few years and maybe kind of give our viewers an insight into what we might be seeing with medical dental collaboration through telehealth?
Well, our vision statement is to improve access to oral health care globally. So we have a small mission statement, but that's really what we're doing with telehealth and teledentistry being a subspecialty of that. We are just improving access to health care. And I call the cell phone the new healthcare tool of this decade, because almost everything can happen on a cell phone or consult with on a cell phone. So many people, I've traveled, thank goodness, many, many places, and no matter how remote you are or how indigenous the people are, they all have cell phones. So cell phones can bring healthcare to people. And if we bring it coordinated healthcare, you don't have periodontal disease in a little world all just in the mouth. You have it because of your underlying medical conditions, and your underlying medical conditions, are caused or stimulated or exacerbated by the periodontal disease. So bringing it together is truly going to improve patients' health care in the near distant future.
And so Jonathan, when you look at kind of your vision of MedOrbis's vision of how this medical dental collaboration is going to shake out, what other applications of it there are that you've thought of, can you talk a little bit about what we're going to see in the near future?
I keep saying, or I should say, highlighting the same point, but that's only because I'm a victim of my upbringing. And in medical school, they kept emphasizing collaboration, they kept emphasizing integration, they kept emphasizing team building exercises, working together, recognizing that that was an essential component of clinical care. And so, I was brainwashed from an early age, but that's really what we seek to do at MediOrbis as well. Building strong collaborations, strong partnerships, being able to provide comprehensive care to patients, and then providing that comprehensive care at the highest level. And as you've heard, I don't care if you're a medical assistant or a physician or anything in between or around. If you can help patients, then there's certainly a role in the, I'd say, the remote journey to telemedicine for a patient.
Well, this is really exciting, what I consider somewhat of a groundbreaking partnership in the world of telehealth. And I really wish you two success. And I expect to see a lot of case studies coming out that I can write about and do more podcasts about in the future. So Maria, if somebody's interested in the teledentists and wants to find out more about it, would they contact you? How can they get in touch with your company?
Sure. Our website is theteledentists.com, and we have all programs on there, and love to talk to anybody about, incorporating teledentistry into their practice, or that's where patients contact us as well. And when they do, we've got, access to both healthcare and dental care, which is healthcare, but medical care and dental care on our site. So it's very exciting and yes, groundbreaking, and hopefully we'll be the new norm. But we are definitely the new right now. So it's exciting place to be.
And then Jonathan, if any of our audience is interested in looking more into MediOrbis, what you have to offer, how would they get in touch with you or your company?
Well, there's only one MediOrbis on the web. So
okay.
Look for us and you'll find us.
Okay, well, great. Appreciate that. Well, thanks a lot. So for our audience and viewers today, we've had Dr. Maria Kunstadter, who is the founder and the chief dental officer for Teledentists, a teledentistry company, and also Dr. Jonathan Wiesen, who is the founder and chief medical officer for MediOrbis, a really exciting medical telehealth company. So again, thank you both. I know you're very busy, and I appreciate your time to share your exciting new partnership in telehealth.
Thanks for having us.
Appreciate it.
We do. We absolutely appreciate the opportunity, Mike. Thank you.